The year was 1958, a time when the Everly Brothers sang of dreams, and residents of Cloquet and the surrounding area realized one, as the doors to Community Memorial Hospital were opened and the brand new 76-bed facility was ready for business. The new structure, sitting high on the hill above the St. Louis River, on land donated by the Northwest Paper Company, was the culmination of a vision fortified by financial support and determination from local residents and businesses, along with help from the Hill-Burton Act that provided funds for hospitals in underserved areas. The new, thoroughly modern hospital included operating rooms, an emergency room, lab, x-ray, delivery room, nursery, laundry, gift shop, cafeteria, and an all-electric kitchen. Unlike the older ward concept, these patient rooms included only 1 or 2 beds.
I came in September of 1958, and the hospital had just opened just before I started practice. My brother preceded me by about 6 months. The two of us came. We were the youngest doctors on the staff, obviously, and we came partly because the hospital had just been built. If the hospital hadn't been here, we would probably have looked elsewhere. We had medical surgical patients on the 3rd floor, and 2 east was pediatrics, 2 west was obstetrics, and we had 2 delivery rooms over what was the entrance at that time. We had no emergency room coverage. We did have an emergency room with 2 gurneys with a drape between them, but those of us who practiced here in Cloquet covered the emergency room, and if somebody came in, we got called from our offices or from home or from whatever, and we took turns rotating on call. Being a small community, we had such a great relationship with the nurses and the aides in the hospital, and the janitors. We all knew each other. We felt like a family. I suspect that's still true here in this hospital, even though it looks like it's about 5 times as big as it was when I was here.
The governor of Minnesota praised the residents and businesses of Cloquet for their support of a new hospital and said local citizens realized that health protection is as essential as fire and police protection. 7 years later, in 1965, a 44-bed nursing home was built adjoining the hospital, and it wasn't long before a second story was added, providing 46 more beds. Many years later, the name would be changed to Sunnyside Healthcare Center. Over the years, the hospital and nursing home flourished with the addition of new departments, programs, and equipment, each adding to the quality of healthcare available in the region. Many of these enhancements have been made possible by the Cloquet Community Memorial Hospital Foundation, which was established in 1988.
The foundation exists purely to ensure that the hospital has what it needs to operate, and to operate at the very, very best of its ability. There are many items within the hospital's budget that they are not able to fulfill. And we all have that same thing in our own budgets, you know, that, for example, when a particular department needs something, they may not be able to fund that. And so they come to the foundation for a grant, and the foundation will grant that money to purchase that equipment or training for the hospital. That's why we exist. And I suppose that if you look at it holistically, what it does is it ensures the health of the community by being certain that we have what we need to meet those needs.
A few of the purchases made possible by the foundation include an elliptical machine for cardiac rehab patients, an ENT surgical microscope, telemetry remote viewing system for the birthing suites that allow nurses to monitor the patient from another room, the emergency department crash carts, including a pediatric cart color-coded according to the child's size. Simply put, the foundation greatly augments the level of health care that can be provided in both the hospital and Sunnyside. The first major renovation since the original construction of the hospital took place in 2004. It included a new emergency department that tripled the size of the original ER, new surgery suites and day surgery area, a separate imaging department, a remodeled laboratory, and new dining activity rooms at Sunnyside. Once again, the project was made possible in part through financial support from the community. As impressive as this building project was, it was just phase one of a multi-stage plan to bring CMH into the 21st century of healthcare. Several years later, building began on phase two.
Phase one, which was completed in 2004 and 2005, took care of a lot of our outpatient needs. But the whole plan had been, let's start with those areas and prepare ourselves for an eventual phase two, which would involve our inpatient areas. So phase two came along, and we knew that our inpatient areas and a lot of support departments were going to need to be addressed. We were excited in both projects to be able to work with local contractors, local lenders, local subcontractors. It really was a community project. A modern hospital is something that, because of our proximity to Duluth, is really a game changer for us. It keeps us going, and you're not going to find a nicer inpatient facility anywhere in northeastern Minnesota or maybe anywhere across the state.
When the construction was complete in the fall of 2013, 80,000 square feet had been added, and the majority of the hospital was new from top to bottom. Private rooms, intensive care, infusion therapy area, waiting rooms, specialty clinic, cafeteria, meeting rooms, in-house MRI, chapel, expanded gift shop, and 3 beautiful birthing suites.
My experience with the birthing suites was calm and relaxed. It had the right atmosphere that we were looking for the kind of birth that I wanted. Everything from the birthing tub, which was really relaxing and helpful, to the staff that were willing to work with me in my birth plan. I just thought overall it went exactly how I wanted it. Everything
was amazing. The staff was amazing. They made us feel welcome and relaxed, and it was just a nice ambiance and environment, and it made our birthing experience everything that we hoped.
CMH is still a work in progress, like the dialysis unit scheduled to open in the very near future that will allow area residents to receive treatment close to home, and the wound clinic that will include the region's first hyperbaric oxygen chamber. The pattern of growth and expansion at Community Memorial Hospital proves that the visionaries of over half a century ago were on the right course, and today's leaders continue to pursue that well-established path as they strive to take healthcare to the next level while maintaining and enhancing one of the community's greatest assets.